So let's talk about the great masqueraders of medicine. These are a bunch of diseases that have some non-specific symptoms and can be quite tricky. I just want to run through a list. They're usually diseases that affect multiple organs that can have all kinds of weird symptoms. So they call them the great masqueraders or great imitators because they're very, very tricky. First one is pulmonary embolus. This is when a blood clot goes in the lung. It can present a lot of different ways. Some people get chest pain, some people get shortness of breath, some people their heart rate races. Could be a lot of things. All your rheumatologic diseases like fibromyalgia, psoriatic arthritis, lupus, sarcoid, those things can all be great imitators. I made a video on lupus if you want to check that one out. There's a lot of infectious diseases that can also be great imitators. Syphilis is the one big one because it usually starts with some skin-like symptoms, but it can affect any organ, even the brain. Lyme's is a big one, HIV as well. TB can affect almost any organ. There's a lot of like tick-borne things like malaria. Well, malaria is mosquito-borne, and there's like brucellosis, nocardiosis. These are kind of rare, but they're worth mentioning. Almost any type of cancer can be a great masquerader because they have all kinds of unique symptoms. So if something's going on, it's worth looking into. MS is certainly a masquerader. Usually you get neurologic symptoms, but it can take some back and forth to figure out exactly what's going on. Celiac disease, of course. This can present many different ways. And then there's some rare ones like Addison's that this is with the kidneys and cortisol levels. Also pheochromocytoma, this is kind of where your body gives off way too many sympathetic drivers and everything just kind of goes off the hill. There's amyloidosis, that's where your body makes some antibodies and proteins and deposits them where they're not supposed to be. That's really the big list. I got a little list here looking through it. Sleep apnea and different hypopnea where people stop breathing in the day or nighttime can certainly cause all kinds of masquerader type symptoms. I will also mention one of the skin type masqueraders. One that kind of throws some people off are actually scabies. Sometimes people will think it's one rash and it's or something else and they'll treat it and won't get better, but it's actually scabies the whole time. I think that's a pretty good list. There's probably a few more, but those are the big ones. There's about 11 main categories, so we'll catch you later. Watch the lupus video if you got a sec. Have a good one. Thanks. We're Jon Swetech over at Swetech Medical Center. Be happy to be your primary care doctor. Thanks.